Delhi Medical Healthcare Academy.
So, good evening, and my name is Dr. Anand, and today we're going to talk about congenital heart disease classification. And it's a wonderful topic, a lot of tongue twisting questions, but try to focus as much as possible. Any doubt, anytime, we are free to ask, and it's a simple and healthy topic. So, let's talk about it. So, before starting any segment, we always have a beautiful quote, and today's beautiful quote is we have is don't lose focus. Like in life, whatever happens, we have to stay focused. We have to stay calm. Whenever you feel a topic is very tough, we need to revise it. And again, you feel it's very tough, then whatever you read, you should teach to your friend. Still you feel is very tough, then you break the topic in three parts, and then you try to teach your friend. That is one way. And if you still feel the topic is tough, you should have 5 almonds per day and 1 spoon of honey. That's it. And but everything will make sense. Just don't lose focus. That's the whole story. So today's topic of choice, we're gonna talk about classification of congenital heart, classification of congenital heart disease, and that is like in that topic only. There's one very quick question they ask in exams. One important cause of radiofemoral delay. Radiofemoral delay. So what is the like again? See, cardiology is like maths, okay? Like it's like mathematics. It's like you just talk about it and try to have an answer. So causes of radiofemoral delay. So the best answer for this question, very importantly, see, if you have aorta, if you know our beautiful aorta, so basically for that, you all know that we have this four chambered heart. So we have the right atrium, right ventricle, left atrium, and left ventricle. And here basically we have the aorta. So this is the aorta. So aorta, we all know that a continuation of the aorta, we have this ascending aorta, arch of aorta, and descending aorta. So naturally, if I talk about a disease known as aortic stenosis, if I talk about a disease known as aortic stenosis, so what happens in a case of aortic stenosis? If I say there is an obstruction in the aorta, right? There is an obstruction in the aorta. So can I say whatever the blood basically is going is not able to go down, like kind of a not able to go to the descending to the thoracic aorta, abdominal aorta, and thoracic and abdominal aorta are connected to what? They are connected to the lower limbs. It's thoracic aorta, no? Then we have the abdominal aorta, and then we have the lower limb entering, the veins enter the lower limb. So that is one very big reason that lower limbs basically the pulses of the lower limb and the pulses of the upper limb, there will be a difference. So this is known as radiofemoral delay. Radiofemoral delay. Are you understanding? So a beautiful like aortic stenosis, or there is one more entity known as kind of a coarctation of aorta. So aortic stenosis, coarctation of aorta. So all these things where the aorta is kind of blocked, and when the aorta is blocked, the blood is not able to go to the thoracic aorta, then abdominal aorta, and then to the lower limbs. So that department will be having a kind of a very feeble pulses, or not a proper pulses as compared to the upper limb pulses. So coarctation of aorta and aortic stenosis are the beautiful examples of radiofemoral delay. That is one important exam question that you should know. Okay, this part is done. Yes, and one more thing very beautiful, apart from aortic stenosis and coarctation of aorta, one more disease you should know, that is Takayasu arteritis. Takayasu arteritis, also remember, it is a large vessel vasculitis. It is a large vessel vasculitis. See, medicine and pediatrics is all interlinking subjects. I can't teach you only one subject without touching the other topic or department. So it's like an interlinking project, okay? It's not just one plain topic. So Takayasu arteritis is also known as, like, it's a large vessel vasculitis. If I ask you, tell me some diseases with large vessel vasculitis. So you have the Takayasu arteritis and giant cell arteritis. So Takayasu arteritis and giant cell arteritis are the important examples of large vessel vasculitis. Large vessel vasculitis, large vessel. Which large vessel are we talking about? Aorta only we are talking about. Indirectly, we are talking about aortic obstruction. Are you understanding? So Takayasu arteritis involves the large vessel causing the aorta to have a obstruction. So same story, that the blood will not be able to go to the lower limbs proper, compared to the upper limbs, leading to a radiofemoral delay. So if I ask you now, tell me two important examples of radiofemoral delay, the best answer for this question will be coarctation of aorta, aortic stenosis, or Takayasu arteritis. Next again question with same category, same story only. Okay, yeah. So very importantly, what is the blood pressure? What is the normal blood pressure of the what you call 4-year-old child? So normal blood pressure of the 4-year-old child, very importantly. So what? So we have a formula. Okay, we have a very simple formula. Okay, the formula to calculate the blood pressure, again, it's a cardiology only topic. So we have the formula for systole and for the diastole. For systole and for the diastole. So remember 90 plus age into 2. 90 plus age into 2 is the formula to calculate the expected systolic blood pressure of a 4-year-old baby. And 55 plus age into 2 is the formula to calculate the expected diastolic blood pressure of a 4-year-old. Like as in the pediatric age group, 5-year-old, 10-year-old, 12-year-old, 6-year-old, coming to us with shock or low blood pressure in the casualty. So we should know like low blood pressure as in what is the normal blood pressure of a 4-year-old. So the expected systolic blood pressure is 90 plus age into 2, whereas diastolic blood pressure is 55 plus age into 2. That's the formula. So what is the age in this question? In this patient is a 4-year-old. So what is the answer? So 90 plus 4 into 2, that is 90 plus 8. So total is 98. And 55 plus 4 into 2, it is 55 plus 8. So that's coming around roughly around 63. So the best answer for this question is nothing but very importantly 98 by 63. So that is one answer you should know. Okay. Now next important point. The next important point. Okay, this much. I hope this much is clear for you. 1 second. Yes. Now continuing with the other what do you call the um topic, same cardiology. Very nice question. Calculate the heart rate of the patient. So calculate the heart rate of the patient, very important. So again, so we have, this is very common, they give you in exams ECG of the patient and calculate the heart rate and all that. So the best answer for this question, again, it's the formula. So what is the formula do we have? Very important. So please remember the formula. So remember one thing very clearly. So this is the P wave, this is the Q wave, this is the R, and this is the S. Okay, so R, these all are the R intervals, right? So the beautiful formula we have is 1500 upon number of small squares. 1500 upon number of small squares between the R interval. I'll repeat again. The formula of, I would say, what you called, yeah, exactly. The formula to calculate this one heart rate in ECG is 1500 upon number of small squares between the RR interval. So what is this small square? So we all know regarding the ECG, we have this what you call large square, and then this again large square. So all these are big, large squares. Okay, these all are the large squares. So every large square will have what? Will have 5 small squares. With every large square, will have 5 small squares. Okay, and that's what the formula is. 1500 upon number of small squares between the RR interval. Okay, so that's what. So what is the answer for this question? So 1500, imagine this is RR we're talking about. So 1500 upon number of small squares. So 5, then 5, 10, then 15, and then we have around 20. Okay. Yeah, 20 and yeah, 22. So roughly, if we talk about in this patient, it will be 1500 upon number of small squares. That is around, roughly, it comes around 75 beats per minute. So one more beautiful question we cover, that how do you calculate heart rate in ECG? So number one, we covered about the how do you calculate the expected systolic blood pressure and the diastolic blood pressure. Then also I told you regarding the radiofemoral delay, where the examples were coarctation of aorta, aortic stenosis, even what you called Takayasu arteritis. All these entities involves the aorta, and aorta is a large vessel. So aortic obstruction will lead to decreased blood supply to the lower limbs basically. Now next question, again same, today's topic of choice, congenital heart disease, right? Classification and all that. So what is the criteria? What is the criteria to diagnose the presence of a congenital heart disease? What is the criteria to diagnose the presence of congenital heart disease? The criteria name we have, that is NADA's criteria. NADA's criteria. So NADA's criteria is the name of the criteria basically, which is used to diagnose the presence of congenital heart disease. And NADA's criteria basically has a major criteria and a minor criteria. So we have the major criteria and we have the minor criteria. Like if some baby is there in our hospital, newborn baby, and I'm thinking that he might have a congenital heart, so I will make sure that baby comes under NADA's criteria, which has a major criteria and a minor criteria. So what is the major and minor criteria? So it's very easy. Major criteria means, very importantly, we have the systolic murmur grade 3 or 4. Like the patient, if the patient has a murmur, like we have a newborn baby, you are the doctor on duty, and what do you call you are expecting that this baby is having a congenital heart disease. So how will you confirm that? You basically will confirm that in number one, you will do the echo of the baby, or at least you put the stat on the baby's chest and see whether the baby has a murmur. So there are two types of murmur: systolic murmur and diastolic murmur. So systolic murmur grade 3 or more, or any diastolic murmur. Number one. Number two, any cyanosis or the features of congestive heart failure. I'll repeat again. We have the NADA's criteria, the topic of choice for today. To diagnose a congenital heart disease, we follow one criteria known as NADA's criteria, which has major criteria and minor criteria. In the major, either the patient has a systolic murmur grade 3 or more, and this you'll get to know by 2D echo only, and any diastolic murmur if the patient has cyanosis or the features of congestive heart failure, as in hepatomegaly, as in ascites, effusion, and all that. Okay, and this is the major criteria. What about the minor criteria? So, systolic murmur of grade less than 3, abnormal second heart sound. I hope you know that we have the S1 and S2. So S1 is the first heart sound and S2 is the second heart sound. First heart sound is because of the closure of the mitral as well as tricuspid valve, whereas second heart sound is because of the closure of the aortic or pulmonary valves, that is A2 and P2. So the minor criteria is systolic murmur of grade less than 3,
and four abnormal things: abnormal second heart sound, abnormal ECG, abnormal chest X-ray, or abnormal blood pressure. So if the patient ECG is abnormal, chest X-ray is abnormal, blood pressure is falling up and down, and abnormal second heart sound or less than 3 systolic murmur of the grade. So this is known as NADA's criteria. This is a very common 5 marks exam question also for theory paper. So exam, they ask in exam that how many major and how many minor should be positive. So we have one major and two minor. If we have one major positive and two minor positive, that is known as NADA's criteria. So this part is done. And this again, try to understand the concept. I am saying systolic murmur, grade 3 or more, diastolic murmur. Like how many grades of murmur are there? Try to link and study. Don't cram. Try to connect. How many grades of murmur are there? So that is important. So are there 3 grades, 4 grades, or 5 grades? If I give you three options, there are 3 grades of murmur, 4 or 5 grades of murmur. Remember, very importantly, there are 6 grades of murmur. Okay, there are 6 grades of murmur. So what are the grades of murmur? And this is again very important question. So there are 6 grades of murmur, and which murmur is moderately loud with a palpable thrill? I hope you know that. Like in murmur, no, we always in the grade of the murmur, we always comment: is it with the thrill or is it without a thrill, right? So how will you get to know that? Yes, so this is a very beautiful and a very important picture showing the grades of the murmur. So grade 1 and grade 6 is very easy, nothing to remember. Obviously, grade 1 will be very faint murmur, whereas grade 6 murmur will be the loudest murmur. Grade 1 is very faint. Grade 6 is the loudest. That is over. Okay. The very faint and the very loudest. So two questions are over. Then we have grade 2 murmur. Grade 2. So what is this grade 2 murmur? So grade 2 murmur will be soft and it will be heard in all positions and no thrill. Now see, you don't have to read everything, but we need to see the important points. Soft murmur, then we have moderately loud, loud, and very loud. So soft murmur, moderately loud, loud, and very loud. So soft murmur will be grade 2. Naturally very faint murmur, grade 1. Soft murmur, grade 2. Moderately loud murmur, grade 3. A loud murmur with a thrill is grade 4. With a thrill. And very loud murmur with thrill. And this murmur is heard with the stethoscope partially off the chest. This is 2 points you need to remember. Murmur like heard with the stethoscope partially off the chest, and grade 6 murmur, the murmur is heard with the stethoscope entirely off the chest, as in like very very loud, like very loud. Okay, so these are the grades of murmur. Let's have a quick revision. How many grades of murmur we have? We have 6 grades of murmur. What they ask in exam, it's important for us to know what comes in exam. Which murmur is without thrill and which murmur is with thrill. So grade 3 murmur, basically till grade 3 you don't have the thrill, whereas grade 4 you have a palpable thrill, and grade 5 will be very loud murmur, and grade 6 is the loudest, that is with thrill, which will be heard with the stethoscope entirely off the chest. Are you understanding? So these are the grades of murmur. Let's have a very quick revision of whatever we have spoken. We spoke a lot of nice questions. In this beautiful class, I got an idea regarding the causes of radiofemoral delay, mainly which were coarctation of aorta, aortic stenosis, and Takayasu arteritis, which is a large vessel vasculitis. Then we got the formula of 90 plus H into 2 for systole and 55 plus H into 2 for diastole. Then also I got the idea regarding to calculate the heart rate in the ECG. We have the 1500 upon number of small squares between the RR interval. This part was done. The criteria to diagnose a congenital heart was NADA's criteria, major and minor, and that you should know how many major and how many minor are positive. We have at least one major and two minor criteria. Then we'll say the child has a congenital heart disease. Grades of murmur, we spoke about it. There are total 6 grades of murmur. And the one very importantly, with a palpable thrill, like with a moderately loud murmur, will be grade 4. Very loud, grade 5. And partially off the chest also, if I keep my chest, you will hear the murmur. And grade 6 will be it will be the loudest. It will have a thrill. And it will be it will be heard with the stethoscope entirely off the chest. Yes, now this is a very nice question. Now this is again classification of congenital heart and indirectly MCQs. So in the right to left shunt, which finding will you expect? Very, very nice AIMS question. In a right to left shunt. Now, firstly, we need to know for the classification of congenital heart, the first question comes to my mind, which is a left to right shunt and which is a right to left shunt. So let me make a small diagram. Yeah, so 1 second. So this is a 4-chambered heart. So this is a 4-chambered heart. We have the right atrium, right ventricle, left atrium, left ventricle, right? This is the pulmonary artery and this is the aorta. Now, if I ask you two simple questions on this planet, what do you call?